too.
All right, guys. Hey, Dentisting friends, it's Paul, Dr. Nacho. I'm with an awesome team in Delaware. We're talking about how to be happier and cry less on the inside. So we've spent 90 minutes with this awesome team telling us about what their favorite nacho topping is, where they are in the dentisting circle of life, mad, sad, or bad. Someone's only 5 weeks in. Feel bad for her. She's got a long dental life ahead of herself, but oh, she's back there. She hears me. So we're going to go around and talk about your name, how many years you've been in this dentisting world, and one thing you learned, you wrote on that piece of paper that you say, I'm going to use this tomorrow, I'm going to use this afternoon, or this was a really good way to think about things. And I'm going to start in the back with Lori.
Hi, I'm Lori. I've been in the dental field for about 22 years. And what I learned today that I'm going to use is to have kindness and firmness.
Kindness and firmness, yes. That's a great, I like that, Lori. Next to Lori.
Hi, I'm Lisa. I've been in the dental field about 17 years, and I am going to void the word policy out of my vocabulary and always use the word protocol.
Nice, I love that one. That's a great one. No policy. No one likes hearing that, even if it's true. Protocol
Less offensive.
softer. Nice.
Hi, I'm Andrea. I've been dentisting for about
I love
27
that.
years. And I'm going to start using the word coupon. for
Coupon
dental
instead of insurance. It's going to change the whole
I
vibe.
think that's
And a
great.
dentisting human is all of us. The dentisting human is if you're front desk, hygienist, if you're battling day to day, you are a dentisting human out there. It's over.
Absolutely.
Hi, I'm Laura. I've been in the dental field for 44 years, a long time. I'm going to stop using the word but.
I like that. And instead, what are you going to use?
Many other words
Yes.
that are not word but, however, perhaps.
Yeah. However, perhaps, and it's just how you make people feel. Great, Laura.
Hi, my name's Debbie. I've been dentisting for 36 years now. I am going to make an effort to avoid the word need.
Need, yes. And what are you going to sub it with?
I think I like benefit.
Yeah, would benefit from. You need a crown. People say you need a crown. You need to save money. You need this. Doesn't feel good. Say you would benefit from putting part of your paycheck into a 401k. It can work for anything in life. You would benefit from doing scaling and root planing where we clean underneath the gums. You would benefit from a sleep appliance. Perfect. Okay.
My name's Penny. I've been at Pike Creek Dental for 35 years, and one of the things I learned today was when a patient is not so happy to say, I see what you're saying, tell me more about that.
Yeah, tell me more about that. It's from a Mark Doro Consulting. Tell me more about that. Works anytime. People come into your house and say, I'm so mad at my sister. I'm so mad at my boss. I'm so mad. They're jerks. No, see what you're saying. Even they have no idea what they're saying. See what you're saying. Tell me more about that. And then you control the conversation. Conversation is like you're controlling it. And tell me more about that.
Hi, my name is Jill. I've been dentisting for 13 years, and I think I came away from, I'm going to start highlighting the positive and then understanding challenges.
Yeah, highlight the positive. So in this perfect example, when you merge dental offices like we have, there's multiple providers. Sometimes that's new for a patient. They're used to just seeing one dentist, and they say, totally understand that. One of the benefits, or highlight that, hey, if you have an emergency, we're open like 6 days a week here. And, previous dentists are open 3. Or, if someone's on vacation, we have someone here. You get to meet a lot. I mean, actually, this made me think of it. When I am sharing with patients, could they see my associate instead of me? I say, I really want to share the joy of your teeth with other people. And they always smile when I say that. And then for some of the patients who are very, we have a phrase TSD, that's so dentist, which means like kind of negative. Just say to them, if you have any problems or concerns after your visit with this, say person's name, always say their name, right? New hygienist, new associate, just let me know personally. I'll be happy to take care of it. Because then you free them up to share with you, and they know what they're actually going to share, that they loved it. And now they have 2 hygienists, and they're going to be glad you pushed them off this diving board into a safe pool instead of a bed of rocks, and say, oh yeah, now I have 2 dentists. So good one, Joe. I like that. Next to Joe.
My name is Jen. I've been in the dental field for 19 years. I'm going to try not to use the word but anymore.
Like that.
And try to use however and try to figure out some other words that'll.
Yeah, just not conversation stoppers or
Yeah.
push back on that. And a lot of it's right. It's like, can I just pay? Or do you guys take my insurance? Right? It's a question that people ask and say, we don't take your insurance, but the way it works is just anytime you have any challenging, the way it works is a really good brain thing. And there's actually my team members I've taught, there's something that I just want to share on the video and for you guys to have, and it's probably the most golden nacho of the entire thing. This will help you in life. People ask you a lot of weird questions. People ask you a lot of dumb questions. People ask you a lot of scared questions. People actually ask you good questions that you just don't know the answer to at that time. So when anyone asks you a question, why doesn't my insurance cover that? Will my implant fall out? My sister's implant fell out. And your brain says, oh geez, I don't know what to say. Just say, that's a good question. I would want to know that too. That's one of the best things. That's a good question. I would want to know that too. As weird as it is, because it makes them feel normal and it gives you that pause to think. And then you go into the way it works. That's a good question. I would want to know that too if I could pay $1 a month for the rest of my life for my implant care. It's a good question. It's not a good question. You're just exaggerating. The way it works here is we do pay in full, we do payment plan, blah, blah, blah. And what perfect one to finish up on, Bad Teresa. Why am I saying bad? Baby age dentisting human Teresa, 5 weeks in. What's a takeaway from this session?
I have to say that for me, with just being new, kindness I'm fine, it's probably more firmness.
Firmness,
that I
gotcha.
need to practice.
Sometimes we want to be likable so much, but we wind up annoying people around us, including ourselves later. And it's a hard line to walk. But if you're kind and firm, and one of the things too is before you make a decision that you can't walk back, right? Let's say you say, oh, it's no big deal if you don't bring your crown portion. Now the patient's in the operatory, and it's hard to walk that back, right? But when they're in the waiting room, it's easy to walk that back. And I say to dentists all the time, I believe this, I say, it's 9 o'clock Monday morning, and you're ready to insert a crown. This is always a bad thing. When you see somebody who's not supposed to be in the operatory come in, right? When it's the front desk person, like I got a surprise. Am I handsome and funny? No, that's not the surprise, right? The surprise is Bob didn't bring his wallet. Do you want to cement a crown? There's no right or wrong answer to that. Engage with your team. Maybe one of the dentists is going to say, this is someone who always goes on vacation. I want to cement their crown, and we'll take the risk. I'll take the risk that they're not going to pay. It might be one that, one of the things is if you tell your children they can't have ice cream after dinner, and our protocol is no ice cream after dinner, and we talk about it, it's really important to stick to that in the beginning. Because the second someone lets them have ice cream after dinner, you've lost all that momentum. So really great kindness and firmness. All right, guys, we're going to let you guys have a break. More chocolate. Thanks for being so awesome. If you guys want any more information, just reach out to us at dentalnachos.com.